Hi, everybody. Welcome. We're glad you took some time this evening to join us. I am Alyssa DeFilippo with Parents Helping Parents. I manage a program called Connections California. We are an online, statewide resource and information hub for transition to adulthood and adult services. So, what we need to know about receiving public benefits while working? If that's what you want to know, you are at the right place. So no stranger to our Connections California screen. Attorney Ellen Cookman founded Cookman Law in 2015 to help families of all shapes and sizes plan for the future and utilize available resources. Ellen is a certified specialist in estate planning, trust, and probate law from the California State Bar Board of Legal Specialization. That is a mouthful. Cookman Law specializes in estate planning, special needs planning, and trust administration. They help families put together a team of professionals and family members to provide the additional financial and care management and support that will be needed when we can no longer provide it. So, thank you, Ellen, for being here. Thank you, Beatrice, for translating, and thank you all for being here.
Thank you so much. I'm really excited to be here. I love Parents Helping Parents, so it's just great, and it's always wonderful to work with Alyssa. So let me share my screen, make sure you guys can all see this. Do you see this lovely, handsome man who's on the computer? Yes, I'll assume yes.
Yes,
Good.
we do. Yes, perfect.
Okay, so yes, so today we're talking about working and receiving public benefits at the same time. And so it may be for you, it may be for a loved one that you know, but the government actually wants this to happen. They want people to work and achieve their highest goals. And so I want to bring some of that to life. So a little bit about me, as Alyssa kindly explained, I'm an attorney, and this is what I do. I love helping the special needs community. And also I have an older son who has high functioning autism. He just turned 13, and then I have a younger son who's neurotypical, and my husband used to be a special ed teacher, so it's all in the family. But I like learning about these things, also looking ahead for my son who knows, what his future will be. I think it'll be bright, but we never know. So when we're looking at working, so the government calls it work incentives. They're trying to provide incentives for people to start working, even if they're receiving public benefits. So they want you to be able to maintain your cash benefits kind of as a safety net to make sure that you have enough to live on and to thrive. And sometimes this is true even when you're earning more than you typically should be able to qualify. So there's some wiggle room there. We also want people to reach their vocational goals, so they're able to save up money towards that. Ultimately, we're trying to transition folks into the workforce, but with a safety net that they can go back to receiving their public benefits if they become unable to work. There's a lot of people, especially in the mental health community, who are able to work for some time, and then it gets to be too much and they need to take a break. But you can be worried, what if I work and then I lose my benefits? Am I out of luck for the rest of my life? And the good news is no. But you have to know, what is the path to get back on the benefits? But overall, they're trying to incentivize disabled people to work. So to understand which incentives might apply to you, first, you kind of have to understand which public benefits you get. And you may know, which is great, but I have a lot of clients who come in and they're talking about their wonderful kids, and they say, well, my child receives Social Security. And I'm like, okay, which type? And they go, oh, there's more than one type. So we're going to talk about that. We're going to break down which are the different public benefits, because some of the incentives apply to some benefits and some apply to other benefits. Then we're going to talk about specifically dive a little bit deeper into the cash benefits, basically SSI and SSDI with child disability benefits under the SSDI umbrella. And then we'll talk through the actual work incentives once we have a better picture, so you can think, this could apply to me. Maybe this one doesn't. All right. So I love starting with my big old chart about public benefits. And you may have seen this before, but I feel like it's always good to have a refresher. And if this is your first time, hang in there because it's like a new language. I do also want to mention, I have a YouTube channel, and on my YouTube channel, I have videos on each of these topics. So if there's something that you don't understand, you can always go and do a search Ellen Cookman Law and look up the topic, and it may just come up. You don't know. Okay, so what I like thinking about is if you're disabled and you're not able to work because of your disability, there's two things that everybody needs. Okay, two things that you get when you're working. You get an income stream, which is your salary, and you get health insurance. Now, I'm so hoping that someday our country will figure out what all the other developed countries in the world have figured out, that we don't need to have health insurance coupled with employment, but we're not there yet, and it's getting worse. So we need to figure out, how do we get somebody to have secure health insurance? So those are the two columns, right? The income stream column on the left and then health insurance on the right. Then the top and the bottom are basically broken up into whether you need it or not because you're poor, all right? So the top two, SSI and Medi-Cal, are called needs-based public benefits because you don't have a lot of resources or income, and so you need them. The ones on the bottom, SSDI and Medicare, we call entitlement-based benefits because somebody has worked for a while and paid into the system, and now they're entitled to it, or a family member is entitled. Okay, so let's dive in a little bit deeper. So, and we'll talk about the top two a little bit, but I just want to give a brief overview. So top left is SSI, Supplemental Security Income. This is the most restrictive of them all because you see that resource limit in red, $2,000. You can only have $2,000 of countable assets and still qualify for SSI. And SSI is intended to supplement whatever other income you might be receiving, okay? And it can supplement up to about $1,200 a month. Now, if you get just $1 of SSI, you automatically qualify for Medi-Cal, which is California's version of the federal Medicaid system, okay? So it's health insurance. And I was actually on Medi-Cal for a short period in between jobs, and it worked. It worked. So you get right now there's no resource limit for Medi-Cal, but unfortunately, the resource limit, how much you can have in the bank and still qualify for Medi-Cal if you're disabled, that is being implemented again starting in January of next year, in 2026. It's going to be at $130,000. Now, keep in mind, in every other state, it's at $2,000. So we're pretty lucky here in California. It's higher, but it was better when there was no resource limit at all, I got to admit, okay? And then you also have a monthly income limit. You can be receiving about $1,800 a month of earned or unearned income and still get Medi-Cal for free. If you go over that income limit, you have to pay something called a share of cost, which could be very punishing. Now, under that Medi-Cal umbrella is IHSS, in-home support services. So if you're disabled and you need help with your activities of daily living, you can get IHSS, and the eligibility rules are the same as those of Medi-Cal. Okay, so now let's look, the bottom left is SSDI, Social Security Disability Insurance. Somebody paid into the system and then became disabled. Then they get an income stream. Or somebody paid into the system and they retired and their child became disabled before age 22 and gets part of the parent's income stream, or gets an income stream at the same time that the parent gets one. Now, after 2 years of receiving SSDI or CDB benefits, you get Medicare, all right? And Medicare is something that everybody gets when they turn 65, but you can also get it if you're disabled, which is super cool, all right? And some people get both. They get Medi-Cal and Medicare We call them Medi-Medi. So now I want to take a look just from a timeline benefit to see if you or your kid, because it's not a static determination. It actually, the public benefits that you receive can change over time. All right, so let's take a look. So here we have this timeline, and this is from the disabled child's perspective. Okay, so they're born and they're all on the left side. They can qualify for Medicaid or Medi-Cal in California. So everybody in California under age 18 can get Medi-Cal under a waiver program. And then they turn 18, and now all of a sudden they're an adult, which is kind of funny if you know 18-year-olds, but they're an adult, and their parents' money is not attributable to them. So now they qualify for SSI, all right? Because they're poor and they have under $2,000 of assets. So now they're getting SSI and Medi-Cal under a different umbrella. And time goes on and on and on. And then the parent retires, okay? And I'm putting that in when the child's in their mid 40s, but who knows when, but you know, that could be it. And at that point, the parent starts getting Social Security in their retirement, if they do. And the child can receive half of what the parent is getting at the same time that the parent gets the full amount. That's child disability benefits. And I have another slide on it, so I'll go into a little bit more detail. And then after 2 years, the child also starts getting Medicare, all right? So the child might be receiving all four. Or when the child starts getting child disability benefits, they might lose their SSI. Okay, so it just depends. You have to kind of know, where am I in this whole timeline? What is going on in my family? And then when the parent dies, the child's child disability benefits goes up to 3/4 of what the parent was receiving in Social Security. And then time goes on, and then the child dies. Okay, so that's my overview of public benefits. So now let's look a bit more at the left-hand ones, the cash benefits, SSI and SSDI, because these are really the ones that are impacted by the work incentives. And you really need to know, which of these do you receive? So which work incentive can you qualify for? So SSI. So as I mentioned, up until the child turns 18, the parents' resources are deemed, or they're attributable to the child, and so the child has too much money to qualify for Social Security, for SSI. But then when they turn 18, ta-da, their parents' money does not count as their money, and the child, even if the child's living at home, the child can now qualify for SSI if they're disabled and they're not able to work because of their disability. They can receive up to about $1,200 a month, and they qualify for Medi-Cal. Now, you have to go through Social Security Administration to qualify for SSI. And the definition by Social Security Administration is somebody who has a physical or mental impairment that will last 12 months or longer, or soon lead to death, that prevents that person from engaging in substantial gainful employment, which in 2025 is about $1,550 a month. So they're looking to see, do you have a disability that interferes with you being able to work? All right, that's the whole test. When they're looking at SSI, they deduct either dollar for dollar or dollar for half a dollar, and I'll show you how that works, any other income you're receiving. So it's supposed to supplement any income you're already getting. So if you're getting some earned income, it can supplement the income that you're earning. If you're receiving unearned income, it supplements that unearned income. And then there are some exclusions that are counted as income, but it doesn't interfere with your SSI. That would be payments made out of an ABLE account. We'll touch on ABLE accounts later on. And then also if somebody else is paying your bills that don't include shelter. All right. And what I'll do is after I go over SSDI, I'm going to pause and I'll open that up to a few questions, if that's okay, Alyssa. So let me go over Social Security Disability Insurance, and then we can take some questions, and then we can look at work incentives. So SSDI, Social Security Disability Insurance. Now you'll notice the names are very similar, right? SSI, SSDI, and also Medi-Cal, Medicare. They sound the same, which is horrible, but they're very different programs. So for SSDI, this means somebody has worked and paid into the system. Okay, so to start getting SSDI, usually you'd have a worker who needs to work at least 20 credits within the last 10 years. But if you're younger, then you don't have to work as many credits. So and I don't have a slide that really breaks that down, but there's a certain amount that you need to work at certain ages where you have paid in enough to start getting SSDI, all right? So SSDI does not look at your income, and it doesn't look at your resources. The only thing it cares about is if you earn too much, that can bump you off of your SSDI. So it's only earned income that they're looking at. Now, to qualify for SSDI, it's the same eligibility requirements that I just read out loud for SSI. So it's this exact same thing, all right? So if you qualify, then they calculate, okay, how much did you pay into the system? How much do you earn? And a lot of times you may have started earning more than your SSI. And if you, let's say you worked for a while and then you became disabled and you get like $1,400 a month of SSDI. Since that is over the $1,200 a month, you don't get SSI anymore, because SSI is meant to supplement any income that you're receiving, all right? But that's okay, because you're getting SSDI and they're not looking at your assets or your income anymore. Yay! So I think SSDI it's a more flexible program. And then after 24 months, and then there's a 5-month waiting period for SSDI, then you receive Medicare. It's a good program, right? And so these are all the people who can receive SSDI if you worked and paid into the system. If you're married to somebody who worked and paid into the system and you're over age 62, or you're caring for somebody who's a minor or disabled, you can receive SSDI. If you're a widowed spouse, you can. If you're a divorced spouse, you can receive SSDI based on your ex-spouse's work record. And if you're a child and you became disabled before age 22, that's child disability benefits. So we're going to take that last little box, child, and we're going to expand it into this slide. So child disability benefits. I love focusing on this one because this is the one that a lot of parents miss. And nobody's telling you that your child qualifies for this. I've seen a lot of families where parents retire, their kid is getting SSI, and they don't say, hey, now your kid should receive child disability benefits. They just don't tell you these things. So I want you to know this, all right? So if you've worked for a bit and you qualify for Social Security, you start receiving your Social Security, and your child became disabled before age 22, your child should qualify for child disability benefits. They get half of what you're receiving at the same time that you get your full amount. Now, there is a certain amount that you can receive, like if you have several disabled children and a spouse who's all receiving an income stream through your retirement, there's a limit. But typically, if it's just one kid, you can get half, the child can get half of whatever you're receiving, and then the child gets 3/4 when you pass away. And for the child, there's no passive income or resource test, which is so wonderful. And the child gets Medicare after 24 months. There's not even that 5-month waiting period. All right. So I think that's one of the best reasons to qualify for CDB benefits, because then your child gets Medicare and they're basically set for life. All right, so I'm going to pause for a second and open this up to some questions. I'm not sure, Alyssa, if you're there and if you want to see if there's any good questions that we should dive into right now.
So I am definitely here.
Great.
I do not believe there are any questions that are really pertinent to the material you just covered right now. So I
Okay.
feel we'd be taking some tangents that will
Ah,
throw us way off where we want to be.
okay.
So I think we should just continue on and stop again if you feel like there's a good stopping point and we can check back.
Okay, sounds good. And I promise we'll have lots of time to answer questions. So please, yeah, type in your question, write it down. We're all good.
And
I
remember,
also just,
questions in the Q&A, please, or else I will lose your question. Okay?
okay,
Thank you.
Q&A, not the chat. Okay, awesome. Thank you. Okay, so now let's talk about work incentives. So this is where the government gives us a bit more wiggle room to help our kids who are receiving public benefits be able to work at the same time as receiving those public benefits. Okay, so here are 4 of the work incentives that I'm going to cover that apply to people who are receiving both SSI and SSDI. So remember, I was saying, okay, you got to figure out which one are you getting, right? Is it SSI or is it SSDI? And here's a quick tip. If it's more than $1,200 a month, it's probably SSDI. All right. Or if it's $1,200 a month, it could be a combination of the two. You might be receiving both. So let's look at these work incentives that allow you to receive your SSI and SSDI and maybe put aside some money or do some other things. So the first one is called impairment-related work expenses. So this is basically if you're working and you need to use some of your income to pay for things to allow you to work. All right, so if you need to buy a wheelchair, if you need to make co-payments, other medical expenses, due to your medical condition, then you have to keep receipts, and then that's basically deducted from what's your countable income. All right, so it's a really nice, great. It's a nice way to lower what your income looks like to Social Security by basically providing, you got to bring the receipts, right? So you have receipts of different things that that you need in order to perform your job, and they will allow you to basically not look at that income, that portion of the income, because you're using it for these work-related expenses. So here is a slide. It's pretty small, but I will make these slides available. So you see some part of them are deductible and some are not deductible. So I'm going to zoom in, although just with my eyeballs. So for example, if you need to make a modification to your vehicle in order to get to work, that's deductible. But if you just buy a vehicle, that's not deductible. So you want to look carefully at, the thing that you're looking at doing and saying, okay, is this actually deductible? Will this lower my countable income or will it not? All right. So this is especially important for people who have, physical handicaps or disabilities, or they need, prescription drugs to be able to keep working. All right, the next one I really like. It's called Ticket to Work. So it's a program for people with who are receiving SSI and SSDI, and basically they're trying to set you up with a roadmap of how to get to your goals. And so you get what's called a ticket, all right? And so you work with a service provider who's authorized by Social Security Administration, and they help you to get job readiness training, go through job coaches. They provide transportation in order to reach your personal employment goals, right? Now, while you're under this program, while you're making progress towards your goals, they don't require a continuing disability review. They don't look to see, oh, are you still disabled or not? And you can go through your regional center if you're a member of the regional center, or through the Department of Rehabilitation. A lot of people are using this program. So it's a really great program, and you get to keep your Medi-Cal and Medicare benefits while you have this ticket. And I think one of the best ways to understand this program is to look at an example. So let's look at our example of Alex. All right, so she's receiving SSI and Medi-Cal, age 27. She loves art and she wants to work at the local art supply store, but she's worried that she'll lose her SSI and Medi-Cal if she is working. So what does she do? She enrolls in the Ticket to Work program, and she chooses an employment network that is approved by Social Security Administration. And that network helps her with her career planning, job interviews, job training, coaching, and getting her transportation to and from her employer. So then Alex gets hired at the art supply store, and she's continuing to develop her skills. So during that whole time, she's on this Ticket to Work program, right? So she's getting her SSI and her Medi-Cal, and she doesn't have to do continuing disability reviews. Very cool, right? Okay, another program is the Plan for Achieving Self-Support, a PASS program. So this allows individuals who want to set aside some money to achieve their goals. They can set aside that money without it interfering with their SSI or Medi-Cal benefits. So basically, you're putting together a written plan of how you want to achieve your goals. Maybe you want to start a business. Maybe you want to get a very specific type of job. It's good for competitive employment. So a lot of times this can be really good for somebody who has a higher level of functioning, and they really, want to go through a great plan. Okay, so who's eligible for this? So it's for people who otherwise would be eligible for SSI, were it not for their income or assets that they're getting through their employment. Or maybe they got SSI and then it was reduced because of their income, because of their work income. And it really helps people who want to transition off of public benefits ultimately. So I have another example. All right, so this is Sylvia, and she wants to go to school to be a legal secretary, which is great because attorneys, we always need a legal secretary, right? So she's getting SSDI benefits. So let's say that might be child disability benefits from her parent, or that could be she worked for a bit and then she became disabled. So she really wants to be able to work and support herself, but she wants to do this gradually. So she determines that she needs a certain amount per month in order to study to become a legal secretary. So she puts together this plan, this PASS plan, all right, where she says, okay, well, I need $1,280 a month for my tuition, my books, and school supplies. And she lists it all out. And then if this is approved, Social Security Administration excludes that much from her SSDI income, all right? And then there's also a general exclusion. So she's eligible for her full SSI payment, even while she's working and setting aside money for her study plan, all right? But she actually has to use that money for this plan. She can't just say, oh, well, I have this plan, but I'm doing something else, right? So you really do have to carry this out. All right, the last one that applies to both SSI and SSDI is expedited reinstatement. This is basically, how do you get back on public benefits if your work experience didn't work out? Okay, so this applies to folks who were receiving SSI or SSDI or child disability benefits. They return to work and their cash payments and they stopped receiving their cash payments because of their work. But then they become unable to work because their disability returned, or it was just too hard to maintain the employment. And they became unable to work within 5 years of when their benefits ended. So it's basically like a 5-year safety net period. Okay, they can request expedited reinstatement. And this allows them to receive up to 6 months of their cash benefits, while SSA is doing a medical review to see, did you really become disabled, or did you just decide you don't want to work, to see if they can reinstate the benefits. And you can be eligible for Medicare or Medi-Cal during this 6-month process. So that's really helpful. It can provide you the health insurance benefits that you need as you're transitioning perhaps from working back onto public benefits. So that's the safety net that a lot of people can rely on. So now let's look at work incentives that folks who are receiving SSI can qualify for. And this is some number crunching, so I apologize in advance if you don't like math. I'm going to try to make it as easy as possible. The first one is the earned income exclusion. So remember when I said SSI is meant to supplement whatever you're already receiving in your income, okay? So how do they see, okay, if we're supplementing it and you're earning income, it's then they don't do a dollar for dollar deduction. Instead, they say, okay, first $20, we're going to let you get that. And then next $65, you can keep that as well. And then after that $85 of earned income, they're going to deduct basically 50% of your work income. All right, they don't deduct 100%. So this is good. They want people to work while they're getting SSI. So here's my example to kind of try to put this in plainer English. So we have Sam, and he gets $551 in SSDI and $350. He earns $350 a month in wages. How much SSI will he receive? Well, you might think, well, let's see, 551 plus $350 is, $901, and subtract that from 1,200, that's about $300 a month. It doesn't work that way. It's actually a more nuanced calculation that's better for the kiddos who are working. So let's look at how it's treated. Okay, so we have SSDI. This is a passive income. This is unearned income, even though somebody did pay into the system, but they call this unearned, okay? So they say, okay, you're getting $551 in SSDI. We're going to subtract the $20 freebie. That's the general income exclusion. So you have $531 of countable unearned income. Now let's look at the $350 in wages that he has. So we subtract the $20, the freebie that everybody gets for earned or unearned income, and subtract $65, which is an earned income exclusion. All right, so they're taking out the $85, and then whatever's remaining, they divide it in half. That's the 50%. So out of that $350 of earned income, $132.50 of it is countable towards SSI. All right, so not all of it. That's good news. So then we add up, all right, well, so how much is deducted from SSI? So we have $531 plus $132.50. That's the unearned and the earned income. And we get $663.50 of total countable income. So now let's look, okay, so we have about $1,207, it's $1,206.92, whatever it is. And that's how much, that's the maximum in California that you can receive an SSI. It's actually lower in other states, but in California, they supplement it a bit. So we take that and then we subtract the total countable income and we get $543.50. That's how much Sam can get for SSI. It's not the $300 a month that we were thinking, if it was all, if we didn't have this earned income exclusion, it would be less, but now it's $543 a month. So how much income is he getting total? Well, you add up the SSDI, his earned wages, and SSI payment. He's actually getting over $1,400 a month in this example. So that's how the earned income exclusion works. I hope you followed the numbers, right? The other one, the next one that I really like is the Section 1619B work program. So this is for people who are working and but they need to still get medical health coverage in order to continue to work. Okay, so it's if someone is earning something that reduces their SSI to 0, they earn more than $1,200 a month, they can continue to receive Medi-Cal if they meet these criteria. Okay, so they had received SSI in the past 12 months. They continue to meet certain requirements of medical disability and non-disability. They need their health insurance coverage to continue to work, and their income is still less than about $64,000. Okay. Now, I actually have a client whose daughter had qualified for this work program. The daughter was brilliant and worked for NVIDIA, but she was profoundly disabled physically, and she needed in-home support services to get out of the house, to get up, like 2 hours in the morning, 2 hours in the evening. So she was part of this work program where she was working and earning quite a lot at NVIDIA, and she could still keep her Medi-Cal and IHSS benefits. So that's really where this comes into play, right? All right, so then we also have something that's helpful for students. So they're looking at students and saying, all right, if you're getting SSI, they want you to be able to work while you're studying, all right? So if you're under age 22 and you're not the head of the household, you're not married, and you're attending school regularly, then you can exclude some of your income so that you can keep receiving SSI. So what are the requirements? Well, you have to be going to school at least 8 hours per week, or you're in training to prepare for employment, or for 12 hours a week, or if you have hands-on training like an internship, that could be up to 15 hours a week. And also this can apply if you're in middle school or high school, and for at least 12 hours a week. So the most income that can be excluded is $2,350 per month, up to $9,460 annually. And this is for 2025. We anticipate it'll go up a little bit each year. And then after those limits are excluded or are exhausted, then they will be counting your earned income, but under the earned income exclusion that we reviewed before. So what does this look like? We have an example. We have Carlos, all right? So Carlos is age 19, and he's disabled, and he's receiving the full SSI benefits, and he's going to San Jose State. Yay, Carlos, all right? So he's taking 12 units per semester, so he qualifies for this earned income. Now, during the summer, he decided, hey, I want to work, and he gets a really good job, and he's earning $2,000 a month during June, July, and August, all right? So those earnings are less than the top amount that he can earn, which is $2,350 a month. And when you add it up, it adds up to $6,000, which is less than that $9,460 a year. Because it's underneath those caps, he can keep getting SSI during June, July, and August, and continuing into a school year. So each of those months, he's getting his $1,207 of SSI plus his $2,000 of earned income. So he's getting a lot of money, $3,207 a month. We love that. We love that for Carlos. All right. Now let's look. We're almost done. All right. Now we're looking at SSDI incentives. So these only apply to people getting SSDI. So those last 4 or 3 were for SSI recipients. These are for SSDI recipients. Okay, so we're going to look at the trial work period. So somebody can continue to get their full SSDI benefits while they're trying out working. So they can have 9 months of trial, and it doesn't have to be consecutive. It can actually be 9 months spread out over a 5-year period. And this can be over the substantial gainful activity. You can earn more than the $1,620 a month, and you keep getting your SSDI during that trial work period. All right, so you're not throwing away SSDI yet. Then after that period is done, then you switch to an extended period of eligibility. So first 5 years or shorter, okay, is the trial work period. Then we're looking at extended period of eligibility. So you can keep getting SSDI benefits if your work amount is lower than the SGA level. But if you go over that level each month it's over, then you don't get your SSDI. All right. So that's kind of like a 3 more years of trying it out. But in that case, if you're working and getting more than SGA level, you don't get your SSDI. But if you don't hit that amount, then you do get your SSDI. All right. So now that first time that you've gone over the SGA level during the extended period of eligibility, they consider your disability to have ceased, and you get full SSDI payments for that month and then 2 more months. Okay, so that's a grace period. So this is their way of slowly easing people on SSDI back into the workforce. So this is kind of another way of looking at it, right? So first, you need to be, so step 1, right, top left. First, you need to be approved for SSDI through Social Security. And so you have to be earning less than substantial gainful activity in order to be qualified as disabled. And then you're on SSDI for a while, and then you say, okay, I think I'm ready to start working again. So then you get your trial work period, and that is basically, being able to work up to 9 months within 5 years. And then once you've worked 9 months, whenever that has taken place, then you switch to the extended period of eligibility, and you get for 36 months, as long as your earnings remain below the SGA, you get your full SSDI check. And once it goes up over the SGA, then you get checks for 3 more months. All right, so now you're working for a while, yay, and then you have a setback with your disability or another disability or an accident, something happens, then you can go on to expedited reinstatement. Okay, so we already covered that. That's how you get back onto your SSDI check. So you might be thinking, well, what happens with Medicare? I mean, you're on SSDI, you want to keep your Medicare. All right, so this is what happens. If you stop getting SSDI benefits because you're able to work, then you get at least 93 consecutive months of Medicare after the trial work period. Don't make me do the math. How many months is that? About 7 months, about 8. So somewhere in there. I'm sorry, years, excuse me, 7 or 8 years. So happily, Medicare is covered for quite a while. And then after that period, you can buy into your Medicare coverage as long as you still have a disability. All right, so those are the work incentives. However, I want to just mention a few more things. ABLE account benefits. So let's say that you're one of those fortunate kiddos who, like Carlos, right? Carlos was able to work and earn more money, right? He was earning like $3,000 a month during June, July, and August, but his SSI has to be under $2,000 a month. What's he going to do? He can put some of that employment, some of that earnings into an ABLE account for himself. So any money in an ABLE account does not count towards SSI and Medi-Cal eligibility. So that's basically how you protect your earned income once it becomes a resource. So the month that you earn it, it's your income. Once you hold on to it for another month, it turns into a resource, all right? And SSI particularly looks at your resources. It has to be under $2,000. So to shelter that money, you can turn around and put your resources into an ABLE account. Now, an ABLE account is created to receive up to the annual exclusion amount for gift taxes, which this year is $19,000 a year. Next year is probably going to go up to $20,000 a year. But if you're working and earning money, you can put in $19,000 a year plus an additional $15,000 a year of your earned income, as long as you're not participating in your employer's retirement plan. It's kind of considered your own, you're putting away for your own retirement. Okay. And then if you have in your ABLE account less than $100,000, the ABLE account is not countable for SSI purposes. So if it goes over $100,000, then your SSI is suspended. But if you remain under $100,000, then you can continue to get your SSI. And you keep getting Medi-Cal even if it goes over $100,000. So you might be thinking, well, Ellen, this sounds really good, but I'm still not quite sure if my child is getting SSI or SSDI. So here are a few little tricks of the trade, all right? If they're getting just SSI, they typically get their confirmation letter and their check on the first of the month. If they're getting SSDI, they get it on the third day of the month. So take a look at that. And as I mentioned earlier, if they're getting more than about $1,200 a month, they're probably getting SSDI or child disability benefits, because SSI only supplements up to $1,200. So if you go over that amount, it's not SSI, most likely. You can also reach out to the Social Security Administration to figure out which type of benefits they're getting. And usually on their confirmation letter that you receive from Social Security, it'll tell you, you know, your supplemental security income is this, and this is how it's calculated, or your Social Security disability. So you can usually find it on the letter. So now you're thinking, okay, well, I think I know which SSI or SSDI benefits I'm getting or my kid is getting. How do I figure out which work incentives are actually available to my child? So you can reach out to Social Security Administration and be put on hold for a long time and finally talk to them. Or you can complete a form that Social Security Administration provides. It's called a Benefits Planning Query, all right? BPQY, because I guess query gets two letters, a QY. So here's an inquiry example. When you send in an inquiry, this is the letter that you get back. And so Social Security is saying, hey, here you requested the attached benefits query, and you wanted to find out, you provided all this information, and now we're going to show you which benefits, which work incentives your child might qualify for, or you might qualify for. Bam, all right? So they show you, okay, these are the different things that we think you might qualify for, all right? And they just kind of, they break it down. So they say, on the right-hand side, it says, right, SSI work exclusions. Let's see, oh, impairment-related work expenses. Remember, we talked about that. Student earned income exclusions. That was Carlos, earning $2,000 a month for June, July, and August. Pass exclusion, trial work months. And so, you know, then they have the SSDI. And so they tell you what they think you can qualify for. What other resources are there? Well, the top one here, the SSA Red Book, I think is fabulous. So go online to that site, ssa.gov/redbook, and it explains to you all of these benefits. A lot of the information that I got for this presentation, I found in the Red Book. So if you have questions about each of the different benefits, you can look this up, and they have other examples, other ways to do this. And then there's also some organizations that really help with these things. If you're familiar with Disability Rights California, There's a helpline if you're interested in Ticket to Work. And then Department of Rehabilitation has, that's how you go to their planning site. Okay. Just a little bit about my firm, right? So there's 3 attorneys so far. We're looking to hire another one. And some support staff. And what we do is estate planning, special needs planning, and trust administration. So we do not assist with public benefits, and we don't assist with work incentives. Okay, that's something that you would do. We would just be charging too much, honestly. That's something that you would do with those organizations that I have mentioned. But I did want to make this information available, kind of as a, you know, as a public benefit. And we love working with the disability community. So here's my last slide. We have 2 QR codes. If you scan the one on the left, you can get the presentation slides and be added to our monthly email list, which I've heard is very helpful. And then on the right, if you do want to talk to our intake team about your own planning needs, feel free to scan that and it'll populate a calendar and you can get on our calendar. As I mentioned, I do YouTube videos. In fact, I'm filming my batch videos tomorrow. So it's back-to-back fun, right? So please look us up on YouTube. And then we're on Facebook and LinkedIn if you like your social media thing. And finally, bottom left, you see, you know, if you mention that you came to this presentation, we will make a donation to Parents Helping Parents, you know, if you move forward with planning with us. So I'll keep that up for just a few minutes, and maybe now we'll open it up to some questions.
We will, and we have many questions now that
Awesome.
are more directed toward the conversation of the evening. But before that, I'm directing everybody's attention to the chat, where you will find 2 links, one in English, one in Spanish. Please click on it, answer 4 simple questions. I'm going to keep coming back to it because, as I said, I like to get at least 75% participation the evening of, and we have 102 people here. So what does that mean? We want to see about 75, 76 answers. Okay, thank you. Ticket to Work. It sounds like it's something that you think could be a good idea. What happens if you fail or are fired on the job for some reason? You have too many absences or mistakes. Does this count against you? Can you keep doing Ticket to Work? How do you get your benefits again?
Yeah, well, so you need to keep making progress to keep your ticket. If you lose your ticket, then you can go back on your public benefits. So you haven't lost it forever. Okay.
Okay. And how about, does Ticket to Work allow for any kind of one-to-one support? Like if someone needs some help managing diabetes and they happen to also work, does the Ticket to Work problem allow for that, or would you get that through someone else?
I think so. I mean, if it's related to being able to work, then they should be providing resources to, you know, to help you out. You'd want to work with, again, with the regional center, Department of Rehabilitation to, you know, to see what resources are available for your specific situation, because everybody's different. Everybody needs different supports.
So in the workplace. So if you're a regional center client, maybe contact a regional center. If you're a DOR client, and you don't have to be a regional center client to be a DOR, Department of Rehabilitation, so everybody knows what we're talking about, then you might be able to talk to your DOR resource specialist, not
Exactly.
resource specialist, a job specialist about that. Okay.
That's right. Yeah, reach out to them and see what they'll offer. It may be more than you expect.
Okay, and how about, this is about assets. If you can't drive, but you want to buy yourself a self-driving car.
Ooh, wow. I've never heard that one before.
Me neither. I like it.
That is so cool. I don't know.
Yeah,
But
I don't know either, but I know.
write myself a note to look into that, because that's so interesting. I mean, that's the wave of the future. That's where we're headed, which I'm excited about.
I know my daughter is going to ask that question. She's going to, one of these days, I'm going to get that question. All right, we're doing pretty well on the evaluations. We're about 25% the way there, but again, I'm just leaving the chat. The chat is locked now. You can't ask me any more questions in the chat. Just please look at those evaluations and give us some love. Okay. All right, we answered that question. Some people are still concerned about the Medicare, Medi-Cal, Medi-Medi child or adult getting the benefit, starts working. How do you make sure you keep those medical benefits? Couple of questions about that. Keeping medical benefits.
Yeah. Well, so it depends on how you initially received those Medi-Cal benefits, right? So we have like the 1619B work incentive program. If you're receiving Medi-Cal because of your SSI, then if you lose your SSI because of too much income, you can keep your Medi-Cal. So that's one example. For Medicare, if you go on the, you start to be able to work, there is that 93-month period where you still receive Medicare, and then you can buy into the Medicare system. It's kind of presuming that you have enough money built up after those 93 months to be able to buy in. So you shouldn't, as long as you're on one of these paths, I mean, don't just do it willy-nilly, right? Don't just start working and saying, oh, I hope I still keep my medical insurance. But they do provide these methods to stay on your health insurance, because I know that's our big concern,
Right, everybody's.
Exactly.
So the section 1619B,
Mhm.
that doesn't really apply to SSDI. That only applies to SSI.
That's right.
Okay. Okay.
Yep.
That was one
Yeah,
of the
I think I
questions.
have that in the SSI section.
Yes. Yes.
Yeah.
Okay, so we're done with that one. How about if a son just qualified, got his first payment in October, yay,
Mhm.
and I'm assuming this is SSI now,
Okay.
but he's going to start working at a program at school where they will pay between 50 to 100 hours during the school year.
Uh-huh.
How is this going to affect him? How should it be reported? It's a job training program, but I think I know the answer. You're probably going to ask me to answer it. When I say that, you always make me answer the question. Don't make me answer the question. I think he has to report it. I mean, I think it has to be reported.
Oh, yeah. Yeah, no,
As
you're required to
Representative
report all
Caitlin.
of it.
Right.
If they find out that you haven't reported something, there's big penalties, and they can stop the income stream completely. But I mean, we have that SEIE program, the student
Oh, right. The
earned
exclusion.
income
Yeah, the earned income.
exclusion program, where, right, that was Carlos, where Carlos was working, and the first, 9,400 basically was forgiven completely, so you can get your full SSI benefits. And then over 9,400, then you can get, half of basically your work earned income deducted, right? That you get the $85 freebie, and then half of the remaining amount counts towards SSI. So they're working really hard to let you keep as much of your earned income as you can while still working. I mean, sorry, as much of your SSI as you can while still working.
And so this is kind of related. And again, back to the Medicare. So if you're having a combination of the SSDI and SSI,
Mhm.
and you're on it for 2 years and you have Medicare, then
Yeah.
no matter how much the SSDI is, you get Medicare. Yes? Or does the
Ooh,
SSDI have to be a certain amount of money? Excuse me.
that's such a good question. So I guess the question is, if you lose your SSDI because you're working, do you lose your Medicare as well?
That
That's
would be one of
something
the
I feel like I
questions.
should know, and it doesn't come to mind, so I would need to look that up.
Okay. Okay.
Mhm.
And but if you don't lose the SSDI, if it's just a small amount of SSDI and it's SSI and you have the Medicare, you can keep the Medicare as long as everything
Yes,
is status quo.
you bet, you bet.
Okay.
That's right.
Okay. Um, how do you protect, can you protect the adult child benefit in a special needs trust? I'm not quite sure what this person means, like putting the money into
Okay,
the
so
special
I
needs
think I
trust?
know what they're talking about. And this recently came up actually in a slightly different context. So the challenge with this is sometimes people will want to not have the income count towards the public benefits by trying to like irrevocably assign the income to a special needs trust.
Okay.
That really only works with adult child support payments. If you are an adult child and you know, parents have gone through a divorce and they're paying child support, you can actually irrevocably assign that child support to a first party special needs trust so that those payments do not count towards the child's income stream, their income level. Unfortunately, I don't know of a way to do that for any other income stream, including child disability benefits. So, you know, the consequence is child disability benefits could be more than SSI. So you lose your SSI. Now, here's the thing though, you should be able to stay on your Medi-Cal. Even if you don't have SSI, you should be able to keep your Medi-Cal benefits. So then you have Medi-Cal, child disability benefits, and Medicare.
And you stay on the Medi-Cal by potentially going through the county if you lose your SSI,
Yeah,
then you have to
you
switch.
basically, you switch to a different umbrella that
Yeah.
allows you to be on Medi-Cal. So
Yeah.
it's not the deemed Medi-Cal from SSI, it's a different category.
Yeah, yeah.
So you have to do some work, but you can stay on it.
And the benefits, that child benefit, could it just go into a CalAble account then? Would that be a better place?
Once you receive it,
yeah, once you receive it,
you
not putting it
can,
in special needs trust.
but do you really need to? Because it's not,
because you want to use it.
You're not getting SSI, so you don't have an asset limit.
Okay, okay, true that. See, I still get confused about those.
That's right.
It's a lot.
It is. It's confusing, right?
Yes. Here is okay. Someone was reading something that came in the mail, and that as of 2026, the family assets and income of 130,000 will determine whether your child qualifies for Medi-Cal. They just would like some clarification on that as
You got it. Okay.
an aside.
So for a child under age 18, they're still under the waiver program. This is applying to a child who turns 18 and their parents' money is not attributable to them anymore. So it's not really a family thing, it's just the child themselves. If the child has more than $130,000 of assets starting next year, then they won't qualify for a Medi-Cal. So they'll need to put those assets, for example, into a first party special needs trust to protect those assets. Okay. Now, if the child is an adult and is married and has some kids, then the family itself, for each additional family member, you add 65,000. So you'd have 130,000. So if it's a couple, you'd have 130,000 plus 65,000. So 195,000 would be their asset limit. Okay.
Okay. SSDI can't be under 18, need to be over 18, yes?
I believe so.
Yes, I believe so too, but I just wanted to confirm that with you.
Yeah.
So there is that age requirement for SSDI. Do you know anything about the Medi-Cal waiver?
So that's before age 18. I mean, so a waiver is basically a government grant program. So the state says, hey, we think that these are important things to cover for health insurance. And so we're going to provide several. And so there's more than one Medi-Cal waiver. The only one that we've talked about today is the one that covers all the kids in California. Everybody's covered under Medi-Cal. There are several other waiver programs that might cover certain types of disabilities. Like I think ALS is, you know, you just automatically qualify, and renal failure. There's certain other categories that are under a waiver program, but that's basically what it is.
Okay. I'm looking at the clock on the screen. It's 7:38. We did advertise this until 7:45. So is it okay if we stay for just
We can
another
go,
few
keep
minutes?
going,
Okay.
sure.
Do prescriptions count for the IRWE?
Well, so it depends, right? Remember, we looked at that, and I can actually share that. Ooh, let's do that. I'm going to share my screen again, since we have some time. Share, and let's see if I can find it. Actually, you know what? I'm going to go to the right screen before I so I'm not making everybody blind.
Okay. Well, Ellen is doing that. I'm just going to direct everyone's attention once again to those links in the chat. We're about halfway there.
Okay, let's see if this one comes up. Okay, can you guys see that?
Oh my, yes.
Yes, okay.
Very small, but
So,
yes.
here we go. Really small, but if you see on the right side in the middle of the screen, prescription drugs, over-the-counter drugs, and medical services. So it's deductible if it's a regularly prescribed medical treatment that is necessary to control your disabling condition, even if the control is not achieved. Includes copays and insurance deductibles, and here are some different types.
Okay.
It's not deductible if it's allergy treatments, routine annual physical examinations, routine dental examinations. Hemp. Okay, so one of the challenges with cannabis is that
right.
you know, federal rules are different than California rules.
Mm.
When we're looking at SSDI or SSI, that's federally based. So usually cannabis is not considered, you know, it's not covered.
Medically necessary, yeah.
Exactly, yeah. But those are some examples that we can see.
Okay. Okay, and so we know that if one parent retires, a young adult goes on SSDI, getting half of that parent's Social Security benefit. But then the second parent retires and has a larger benefit. They can switch over, right?
Yes, exactly.
But what happens if the both parents are retired and the one dies? And the one who died had the larger amount. Does the adult still get to get the largest amount, whether the person is living or dead? And if dead, does it increase to 75% all the time or only some of the time?
All the time.
Okay.
Yeah. So yes, the larger amount, 50% if the parent's alive and 75% if they've passed.
So it's possible that the larger amount could be 50% of the one who's alive, not 75% of the one who's dead. So you have to look at that.
I'd imagine so. Yeah. So you don't get to combine them, but at least you get the larger one.
Yeah. How about if an adult has a biologically deceased parent and an adoptive parent who the child was removed from? Which parent would Social Security deduct from? If the child has a biological deceased parent and an adoptive parent, which
I don't
parent would
think, I mean, I think if you're a parent is a parent.
And if you're
Like if you've
adopted,
adopted the kid,
if it's legal.
Yeah, if you're legally adopted, then you're just as much of a parent as a biological parent. So I don't think that distinction should make any difference.
Yeah, even if the child was removed from them, I don't know how to comment on that.
Well, if they were not, if then legally they're not their child anymore.
They're not really the guardian anymore.
That's really what we're looking to see.
That's the issue.
You know, it's their legal parentage.
Yeah. Okay. All right. And yes, we talked about the higher benefits. We're just getting through them.
Nice.
Just please, I think maybe you already did this, but clarify about the new qualifications in 2026 for Medi-Cal.
Yes. Okay. So I'll give a little historical background. Forever and ever, Medi-Cal had a $2,000 asset limit. It was awful. It was prohibitive. Then I think it was 2021, in California only. Okay, so this doesn't apply, all the other states, 2,000, it stays at 2,000. But we showed how special and amazing we are in California by passing something where in the middle of 2022, I believe it was, July 2022, the asset limit increased to $130,000 for Medi-Cal, not for SSI, just for Medi-Cal. And then that's kind of like a transition in period, because then in 2024, the asset limit was eradicated. No asset limit at all. There's still an income limit for Medi-Cal, but no asset limit. And that's what we're under today. There's no asset limit. There is an income limit, about $1,800 a month. However, the budget that was just passed this summer said, hey, we're losing too much money. I mean, it's ridiculous, but we're losing too much money by letting any old Joe, apply if they have 3 houses, 4 houses. I mean, these are not what's actually happening, but okay, I'll get off my soapbox.
Yeah, high horse.
So basically, they proposed implementing the draconian $2,000 asset limit. However, there was a lot of pushback and we got to 130,000. So now, starting in January of 2026, they're reinstating the $130,000 asset limit for Medi-Cal, plus $65,000 per extra family member for that family. Okay,
so
and that's not like if you're a dependent kid in a household of other people who are not covered by Medi-Cal, you don't get to count them as 65,000. It's only if you have the whole family is on Medi-Cal and is low income and low assets, then you get to add 65,000 per family member.
So I think I made you explain that twice, but they were like,
that's okay. It's confusing. It's hard, and it's like follow the bouncing ball. Remember when you used to watch subtitles?
Yeah,
and it goes around. Yeah,
I
feel like that. I'm like, whoop whoop. What's going on? Yeah, whiplash.
All right, 7:45. One last question: how much of this is changing in 2026, 2027, 2028? Is there anything, any little tips, anything that's not too negative that you can leave us with?
I know, without pulling out my hair. I wonder, I mean, first of all, we're in California, so that's the good news. Okay. In California, we're really trying to protect a lot of these benefits. And we tax people so that we can. So that's the benefit of our higher taxes here. We actually get something for them. I worry about the regional center being able to provide all the resources that they do right now. I think some of those are probably going to be cut back, like after school programs, maybe some work-related training, stuff that might be viewed as like extra, even though it's not, even though our kids totally need it. Other than that, my crystal ball is kind of shady right now.
Murky.
It's murky. It's
pretty murky.
It's hard to know, but if you do, if you get on my newsletter, I do send out very relevant information all the time. You can take a look. I really try to keep the public up to date because these things are changing quite frequently. That's one reason why a lot of attorneys don't go into special needs planning, because you really do have to understand the public benefits behind it. And to do that, you have to follow it pretty closely. And I'm kind of a nerd that way. It's fascinating to me. So
well, that's good. Well, we're very lucky that you are and that you're willing to come and share your knowledge with us. So 7:47, we are definitely going to end. Thank you so much, Ellen. Thank you, Beatrice, as always, for your expert interpretation. You're getting lots of love and lots of hands. Next week, I think if you have any high school students, we have something on Project Search. If you don't know what it is, do come back next Thursday, I think it is, and find out about Project Search. I think there is one there are many areas of California, actually, they have them. Okay, so thanks again, Ellen. Any last words?
No, but keep doing the amazing work that you're doing. And, and thank you to Alyssa and to all the participants for all the work that they do.
Yes. All right. Thanks a lot, everybody.
All right.
We'll see you next time. Take care.
Bye-bye.